And I do remind people that if you are travelling interstate, we have been saying since June that people need to be aware of the rules. We have been saying since mid-June, if you travel interstate, there is a risk that there will be lockdowns, that there will be restrictions, and that if you do come back, you have to fly, and that you have to go into hotel quarantine. So I appreciate that people are eager to come back, but many of these people have actually gone interstate knowing what the rules were. So for those who have been granted the right to come back but then decided they don't want to fly, then they're just going to have to be patient. We understand the heartache disruption that COVID has caused across the country. There are many families in Victoria who live suburbs away from each other who aren't allowed to visit each other. There are people in New South Wales who are not allowed to go from one area to another to visit households. So it's not just about Queensland and people not being able to come to Queensland to visit. This disruption is happening all over the country. And I'll say this again, let's also remember the over 260 people who have died since the 16th of June. These are loved ones as well, who have died without a loved one by their side, who have had to have a healthcare worker, who have had to stand by and try to pass on loved ones' messages of goodbye. This is heartbreaking. The numbers that stick in my head are the numbers of deaths I hear every day, the number of positive cases. We've had around 50,000 positive cases out of that one initial case on the 16th of June in New South Wales. That has now affected New South Wales, Victoria, ACT and New Zealand. So we can't be complacent. We understand people's frustration, but just like Australians been trying to come back to Australia for 19 months now and have had to wait till there is capacity, we are asking people who are stuck interstate to work with us while we try to build capacity. Now, we have already found some alternate arrangements, such as boarding school students coming back and being able to hotel quarantine, but we have to manage the risk. Today's case is another example. Here's a household, day 14, that's tested positive. So it is not low risk, it is a real risk that people are losing their lives. So we have to keep this in mind in every decision that we make.